and welcome back to another episode of It's Okay Not to Be Okay. This is the continuation, the part two of our previous episode. In our previous episode, we did speak upon what ADHD really is, early signs to recognize, what it looks like between young kids versus teenagers, how emotion plays into all of it. And in this episode, we're going to talk a little bit more about more boys versus girls, how it shows up differently in both, diagnosis and evaluation and treatment, and how to support those, those loved ones who do have it. And again, joining us back for the continuation is our expert, Dr. Rachna Buxani, just to help us a little bit more with some of these questions. Hi.
Hi. Continuing the saga of ADHD. Do you know someone, Amanda, in your family, friends, who's
I used to. Yeah, I had a friend who definitely had ADHD. She has had it when she's been diagnosed since she was little.
Okay. So
I
she's one of the
definitely
lucky ones then. I mean,
she
at
was.
least to be diagnosed so that something could be done about it, right? Because that sometimes that is the issue, that they don't get diagnosed and then kind of continue feeling not good about themselves.
Yeah, I mean, with her, I did definitely see being so close with her. She lived 5 minutes from me. Being so close with her, knowing her for a good amount of years, I definitely saw everything that you had mentioned before, the procrastinating, the super hyperactive, all of it. And I was like, okay, yeah.
Yeah. And it's funny you're saying that. So because coming to your first point about, okay, how does it show up differently with boys
Right.
and girls? In fact, one of the reasons we miss it in girls is because we sometimes, in most situations, not all, of course, your friend being an example of that, but we don't see the restlessness in girls. It's more, when I say restlessness, not, remember
Right.
I talked to you about like the tapping of the pen, or that, yes,
Right.
but that jumping off the walls kind of stuff we don't see in girls, and so it's easier to miss because it isn't that disruptive. So where the boy who has ADHD is literally bouncing off the walls, or jumping from not being able to sit in his chair,
Right.
or jumping off tables. The girl who has ADHD is often quiet, right? Dreamy, like which we spoke about, the daydreaming. Almost. I've had clients who literally tell me that I had my eyes open, I was sleeping. Like, I mean, it was, they're just not there, right? So they can be there listening to somebody talk, but mentally they're just not there.
Right.
So they're in a different world. That procrastination, of course, like you mentioned with your friend, the disorganized, right? Like the chaos, that I don't know where the paper is, or I don't know where my keys are, that sort of thing. So that's kind of how it shows up in girls. And because girls tend to internalize more than externalize emotions, so a lot of what we see is that struggling with the self-esteem and kind of putting on a front as if I'm okay, it's okay, I'll get by. Where boys will display it with that dysregulation or become aggressive or whatever, the girls tend to internalize it more. So I feel like we miss it more in girls than boys because it's much more sort of overt. It's like on your face.
Yeah, I mean, now that you mention it, I feel like there are some signs that you can see it between boys and girls literally firsthand. Again, I mean, with this friend, it was a little bit different because she was to herself the daydreaming, but at the same time, she was very much, I cannot sit still.
Right.
And with the boys, yeah, I saw it. Can't sit still at all. And I was like, okay, I see that.
And it's that disruptive part, because if I can't sit still, but if I'm just like, tapping my foot, that's different than I'm going to get up on the table and start you know. So
Right.
we like it again. This is not every girl or every
Mhm.
boy, but we tend to see that part more in boys, which is why um, there are more boys diagnosed with ADHD.
Right.
Yeah.
Well, speaking on diagnosis and evaluation, like I had mentioned before, in the introduction, I think something that would be useful to some of the viewers with questions instead of jumping into the unknown. What exactly does a proper like ADHD evaluation look like?
Right. And I'm glad you brought that up because um, there's all kinds, right?
Right.
So you can go to a neurologist and they would assess in a very different way than a psychologist would assess. Again, it depends on so many factors why you would choose a neurologist over a psychologist, but both can assess. But generally,
Mhm.
when we think of ADHD assessment, it needs to include, um, your first appointment has to be parents and the child, right? And
Right.
maybe the child for a little bit, but really a lot of it has to come because we need to get the developmental history of the child. This is not something that just started a few days back. This has been going on for some time. So even when we have teens come in, the first appointment has to be with the parents because we really do need to know the history. Now if it's an adult who comes in, and maybe the parents have passed or we don't have, then we try to maybe get in a partner or a sibling, somebody who can give us that collateral sort of information about, hey, how was he growing up, like
Mhm.
uh, how did he manage in school, how did he manage his stuff at home. So all of that information, like did he or she meet developmental milestones, right? So all of that history is very, very important. So it really starts over there. We do some behavior assessments. So these are generally like paper pen assessments.
Mhm.
And if the kid is in school, then it is filled out by some assessments are actually filled out by the child in the like the testing session. So the child does it with the tester, but other than that, we send assessments to the teachers and to the parents, right? To gather more information about, okay, because remember with ADHD, it can't exist only at home, but he's an angel at school, right?
Right.
Like that doesn't make sense. So we do need information from all settings where the child is. So we try to get assessments done, and these are generally behavior assessments that we the rating scales that we send to teachers, we send to parents, so they fill it out. Some neuropsychological assessments are done, and that again is done in session with the child to understand, how much focus, right, the child is able to keep. And a big piece, I think, one of the first things we start with. So after we do um, the first initial session with the parents and the kid, and gathering that information, I
Mhm.
think one of the first things that is very essential to do is the executive functioning, right? Because the executive functioning is almost like an umbrella. So we do that as almost a precursor. So once we do that, then we know, okay, what other assessments do I want to do, right? So we
Right.
pick more assessments based on that executive functioning. And the executive functioning again covers anywhere from, that's like, how good is this child, like is he able to start a task, when he starts a task, is he able to finish the task, right? If how is the emotional dysregulation of this child. So all of that kind of comes under the executive function, the attention, the focus, and all of that. And then obviously, like I said, we pick more neuropsych assessments based on the executive functioning, but most definitely, along with the executive functioning, we would do behavior scales to figure out what's happening with the behavior.
Got it. Okay, yeah, thank you. I mean, I'm sure that, again, super helpful to the people at home wondering, again, I'm completely lost on this. I
Yes.
don't know anything that's going
Yes,
on.
and I'll tell you why. And I appreciate also this question, Amanda, because I
Mhm.
know that there are people out there, because there's psychologists and psychologists, right? So some of them will, and we get reports, right? As therapists, we also do we also do assess children for ADHD. But in the past, when we did not assess children, and when we got reports, we got all kinds of reports. So that, because there's some psychologists who will just have one meeting with a child, and in 2 hours everything is done, and so there isn't that family, that system, and understanding the milestones, understanding the family history. For some of them, it's they won't do the executive functioning piece, which I feel is so important, because how do you know? ADHD, okay, but there's different kinds of ADHD. So what exactly is this child struggling with, so that treatment can be then tailored to meet the child's requirements.
Right, of course, which is again one of the most important. And then so after evaluation, diagnosis, like steps moving forward would include, like you had mentioned, treatment.
Yes.
In regards to that, what I guess what treatment options are most effective for kids and teens with ADHD?
Okay. So when we're talking about kids, right?
Mhm.
So some of the things that help, okay, kids and teens, and then some of them are specific to kids, right? So obviously, behavioral therapy is extremely helpful, because and with behavior therapy comes those aspects also of the emotional regulation and stuff, right? So we work with and that's when you're working one-on-one with a child, to
Right.
to see how we can manage symptoms, how we can modify behavior to a certain extent. Very important component of that is a parent training, right? Because a lot of it is actually guiding parents on what to do. When kids, if you have a difficult child, it's very easy to give in, because, and especially if you've had a long day, if you're tired, or if life in general is stressful for you, I mean, then to come up with the energy to deal with a difficult child. So most often you're just like, okay, you want this, take it,
Right.
just leave me alone, right? So parent training, parent support is extremely important as far as ADHD is concerned. We can, as and especially in the States, right? We have accommodations. We have 504s that we can put into place. So if a child is, or a teen is diagnosed with ADHD, they can get accommodations at school, which could include anywhere from sitting in a specific area that is not overstimulated, to getting extra time on tests,
Yeah.
so that they can focus. I know sometimes schools have, even just for testing, they will allow the kid to take the test in a separate environment, so that they're not affected by everything that's going on around them.
Mhm.
And of course, all of that, along with, there are medication choices that parents can always consider if they feel it's okay, and if they want to go down that route.
Right. Of course. Thank you so much. Yeah, I've definitely seen the 504s face to face when I was in school, even middle school, high school. And I
Yes.
feel like it definitely, yeah, they get the extended time. It allows them to
Yes, and
not,
I
yeah.
honestly encourage parents to do to go down that route. If you feel that your child is struggling, it's great to have the assessment done. Till you have the assessment done, the schools are not going to give you the
Right.
accommodations, right? But it can make or break situations. And as your child grows older, and then when they're taking the SATs and the ACTs, that kind of transfers on to that, right? So to the SATs. So now they're getting extra time for even these college entrance exams, or
Right.
their final exams they're taking, or their AP exams that they're taking. So it really is very helpful. So if parents suspect that their child might have ADHD, I'm a big proponent of go and get the assessment, so that you could then ask the school to put accommodations in place.
Right, of course. And then speaking on parents, I know you also mentioned in the first couple seconds, that parents are one of the most like guiding parents is one of the most effective treatments. How do you think the parent's role of managing ADHD day to day, what do you think is their role in it?
So it's a delicate balance, right?
Mhm.
Because I've known a lot of parents who just do it themselves, like, give it to me, I'll take care of it, because they know that their child is struggling with it, right? So but remember, at some point your child is going to leave and go to college, and then they've got to be able to navigate things by themselves. So it's a delicate balance between, okay, can I help you be a little more organized, okay, so
Mm.
that you can do what you have to do. So we can always, as parents, guide our children in terms of tools, in terms of tips. Okay, you know what, why don't you get a folder and put stuff in there, and maybe have color coded stuff, so that you can get more organized. Or nowadays, use your phone and put reminders in, right? Just being able to guide your children as far as that is concerned, providing that structure, so that there's minimal chaos, right?
Right.
So if you can, in your household, be structured as much as possible, that there isn't, like, things are not changing all the time, or you're not going back, that schedules and routines are not changing all the time, that would be helpful as much as possible, right? Because we also know life is life. Being mindful of things like self-esteem, right? So being able to provide and be that person to your child when they do have difficult moments, and when they are questioning themselves, and to be able to remind them that, no, you know what, you're doing your best. And this is something that you struggle with, but this doesn't define you, right? Like, it doesn't need to consume you. And you've got, because again, like I said, most people with ADHD are brilliant. I mean, creatively, academically, they're brilliant. So to be able to remind them of their strengths, and to be able to focus on their strengths, and maybe help them find paths that they love, but also that they're good at, right? Because that kind of helps boost their self-esteem. So being able to do stuff like that, enrolling in that parent training, right? So being really able to understand, okay, because each child is so unique, even within the umbrella of ADHD, every child is so unique. To be able to understand what the unique needs of your child are, and to be able to provide it as much as possible.
Yeah, of course. And I totally agree. Thank you so much, D-Month. It's so important. I feel like being able to recognize and learn the signs, recognize, how to move forward if you feel like you think your child needs help. I think this was very informative, very helpful for the people watching and not knowing how to take the next couple steps. I thank you so much for your time,
Not at
obviously.
all. Not at all. And you've got to stop thanking me, because we're in this for the long haul. So I guess it's like, okay, until next time.
It is until next time, because this does conclude the two parts of ADHD, specifically in kids versus teens, learning and recognizing and being able to help your child.